We'll get started. So welcome, everyone. Julie, I have the honor of emceeing today's Nursing Excellence Award ceremony. I also have the privilege of doing our land acknowledgement today. And whoops, my apologies. Truly wanted to welcome you to all just take some time just to reflect on the land that you're situated on. Oh, I don't know why that is automatically going. Apologies for that. But certainly I know that I welcome you to take some time to reflect. Oh, sorry, I'm not sure why this is happening. But I really wanted to make sure that, sorry about this. This keeps going off. Really wanted to just provide that land acknowledgement just to say how privileged we are just to provide care on lands that Indigenous peoples have called home for thousands of years. And we recognize and respect the presence and stewardship of all the Indigenous peoples as keepers of our land. Julie, I'd like to turn it over to Tracy MacArthur, our President and CEO of Hamilton Health Sciences, to provide some welcoming remarks. I'm actually going to pause this slideshow and I'm going to just open it up for gallery view just so that Tracy has a moment just to provide some words.
Thank you so much, Janny. It's hard to compete with the land acknowledgement when your photo keeps getting flashed up. So sorry for that, everybody. So wonderful to be here and good afternoon, everyone. And I'm just thrilled to be here today. And it's actually been wonderful to meet so many of you over my past year. There are over 5,000 nurses at HHS. So just a huge compliment of nursing supporting our organization. I'm really inspired by everyone I meet, just the dedication, the professionalism, but most of all, of course, what we always see in those who are attracted to the nursing profession is your compassion and your commitment to really provide the best care possible for our patients. And not only that, but you're also not just care providers, but educators, mentors, researchers, quality improvement specialists, leaders, sometimes just a friendly ear to bounce an idea off of or to share a word with. So thank you so much for everything that you do. And in particular, thank you for those who are taking the time to really mentor the next generation of nurses within our organization. I've had the privilege of meeting many of our externs and other new hires who look up to all of the great nurse leaders within the organization. And it's wonderful to see that we're passing on sort of those values of compassion and excellence to our new hires. We're working right now, and we're really very much on a journey to reimagine the way we provide care, to identify and set some clear standards for our clinical roles and for our teams, and the kind of skill mix throughout our teams, and really embracing some new and innovative models of care. So again, 5,000 strong. I'm really looking forward to the tremendous contributions that you all will make in that process. I'm also thrilled to say that we've had so much success in recruiting so many new nurses into the organization for the past year in particular. And we're also very much focused on our efforts to retain the nurses. And it really is a wonderful opportunity, I think, to share with everyone, particularly those of you who've worked here for a long time. You really can have many careers here at HHS and as a nurse, and we really want to open up those opportunities for some of the new nurses who've joined us more recently to understand what some of the options are and you know, how many different career paths there really are available to you. You can really build an entire career and get all kinds of different experiences through your work here at HHS. I'm really confident with the group of nurses that we now have in place. And as I've certainly walked around understanding that we have filled the majority of those vacancies that we all have within the healthcare sector coming out of COVID, that we're focused on developing new leaders, and we'll continue to make that a priority in the coming year. So maybe just to close, just wanted to share on behalf of the HHS Board of Directors, on behalf of our senior leadership team and really everyone here at Hamilton Health Sciences, please accept our sincere gratitude for everything that you do every day. Your voice, your expertise, and your commitment are absolutely the cornerstone of our work. So I hope you enjoy this afternoon event, and thank you again all so very much.
Right, I'll echo a lot of comments that Tracy has made, and really very, very appreciative to be here today. So just good afternoon, everyone, and it is a joy to be here with all of you and truly to be celebrating the extraordinary care that you provide and the remarkable impact that you make, not just here at Hamilton Health Science, but also in our community and beyond. So as the CNE, I'm just honored, but in awe of people, of how you inspire us with your resilience, your compassion, your teamwork, and your unwavering commitment to patients, families, and to one another. That becomes such a clear theme when we talk to folks through surveys. This is clearly what people are saying is, working together as teams, supporting patient care is number one priority, and we're so thankful and grateful for that. So constantly, currently, but certainly during some of the most challenging times in our career, obviously during COVID, but you showed up, you go above and beyond, and you do it with heart. And I just want to take a moment to recognize not only the care you provide at the bedside, but all the roles that you take on, whether you're shaping care by participating in committees, championing improvements in quality and safety. As Tracy has said, mentoring is so important, mentoring new nurses, or driving innovation changes in practice. And there's been so much done in the past, currently, but we really look forward together in the future for that innovation and creativity as we move forward. So understanding and really appreciative that your voices help guide decisions, and your insights improve processes, and your leadership helps ensure our healthcare system continues to grow stronger and responsive, even more responsive to the needs of our community, which continues to change. But thank you for your attention and your responsiveness to that. So as integral members of the interdisciplinary teams, you bring both skill and humanity to everything you do. You're educators, you're advocates, you're researchers, problem solvers, and above all, you are compassionate caregivers. You are mentoring the next generation, advancing health equity, influencing policy, and helping us imagine what's possible in healthcare. You're truly the heart of our hospitals. I think we all know that nursing is more than a profession. It's a calling, and the work you do every single day touches lives in profound and lasting ways. You make people feel seen, safe, and cared for when they need it most. So today it gives me great pleasure to thank you personally, to thank you for your expertise, your leadership, and the many roles you play that sometimes go often unrecognized, but are always deeply valued. Thank you for being an inspiration to your patients, your colleagues, and to all of us. And most of all, thank you for being a nurse at Hamilton Health Science. Thank you.
Thank you, Tracy and Leslie. We're really here to celebrate everyone who's demonstrated nursing excellence and really who have inspired others. And every year we do like to recognize and celebrate all of our outstanding nurses who care for our patients and their families, our community, and also highlight so many contributions of HHS nurses and of our nursing teams across our wide organization. Our Nursing Excellence Awards really does provide peer-to-peer opportunity for nurses to be able to recognize and celebrate these achievements. And this year, very pleased to announce that we received well over 240 nominations, and that's inclusive of individual nominations as well as team ones. We had 7 individual award categories and 2 team awards available, and I know many of you have received multiple nominations. We had the great joy, of course, to read all of those, and it was quite inspiring just to read just the achievements and the celebrations, really recognizing the passion and also dedication to our nursing excellence at HHS. And echoing what Tracy and Leslie have said, truly we are so lucky to have nurses like you caring for our patients and our community and of course each other. We do have a lot of people to really thank, just in terms of preparing for this Nursing Week celebrations, but also in preparation for this Nursing Award ceremony. A lot of key people who were really instrumental to this process. We had a high school co-op student, so Victoria had that painstaking task of blinding and blinding all the identifying information. And to Dorothy Petty, of course, she's our admin extraordinaire. Both of them had dedicated so many hours and truly a lot of hard work in supporting this awards process. We had the awards scoring committee. They had the pleasure and the joy, of course, of reading all of these blinded submissions. And each member of that selection committee were given approximately 40 nominations to read and score. So, of course, we know that represented a great deal of time and effort. And we also celebrate their emotional and psychological sort of fortitude to go through all of this just for their nursing peers. So thank you. We had last year's award winners, Emily White, Tanisha O'Brien, Ryan McNally, Carol Plumer, Shelley Farrell, Gidget Carlin, and Alison DeHont. They were also key members in participating in the scoring process. And of course, today's award winners, you need to take note because we will be tapping you on the shoulder next year in terms of your responsibility for scoring, but of course, thanking others too who were instrumental. So Kasha McNeil, Jillian McGuire, Elena Aquino, Kelly Nanskaville, Jeff Andrews, Liberty Espilla, Sam Jennings, Sarah Gracie, Diane Norman, and Ari Kohlerman for your tremendous contributions, of course. And moving on, a very sincere thank you to Jennifer Lounsbury, our Chief Nursing Information Officer. She's always my partner in crime and my co-lead during this scoring process, so thank you very much. So for today's awards, what we'll do is I will read aloud each of the award criteria, and then of course invite the winners or their delegates to turn on their camera and say a few words if they wish. And we're shifting gears this year in terms of moving from in-person to a virtual event. So each award winner will be physically presented their award in person at the winners unit and site. So we'll begin with our Nursing Team Excellence Award. This is one of 2 awards. To meet the criteria of this award, teams have to be comprised of 3 or more nurses, and they exemplify HHS values and embody the vision of nursing excellence always. These teams role model collaboration and make a difference in the lives of patients, families, peers, and the community. They demonstrate outstanding practices, communication, teamwork, and improved nurse-sensitive outcomes. And our winners last year included the General Site's 8 South and 8 West Acute Medicine Unit, as well as West Lincoln's obstetrics team. And truly, both are very, very sad to see those trophies leave their unit. They're fighting tooth and nail to keep them, and of course, they are quite anxious to get them back. But we did receive many wonderful nominations describing our nursing teams. And the scoring committee had the difficult task of reviewing 35 outstanding submissions this year. They're all listed here, and a few of them were actually repeated. I wish at this time we had some type of award or some drum rolls or anything, but we will certainly imagine that in our mind. But very happy to announce that our first Nursing Team Excellence Award winner is B2 North Stroke Rehab Nursing Team at the Regional Rehab Center within Hamilton General Hospital. For those who are part of the private Facebook group, I know that there are many posts from staff about the way they celebrate and, of course, support each other. This is a really fun and engaging team. We received 3 nursing team nominations for this, and I'll read aloud a few key points. So this is a rehab team with many great qualities, hardworking, great collaborators, and strive to achieve high standards. They're actively preparing for stroke accreditation in May. They strive for greatness, and they're truly exceptional at providing quality patient care. Every patient that gets discharged doesn't want to leave. And that, I think, speaks to the great care that they provide. Truly, the care that's provided is safe, competent, ethical, and evidence-based with the focus on patient-centered care. They show commitment and professionalism in supporting patients along their journey from acute stages to successful discharge and also reintegration back into the community. They utilize therapies to address unique physical, cognitive, emotional, and social challenges, and they have unwavering commitment to excellence and patient-centered care. They really try to, they give a couple of examples in terms of how they've optimized Epic for this team to better patient care, creating different smart phrases to really capture more accurate charting and really identify gaps. And they recently created Epic Smart Phrases for nursing unit-to-unit TOA, and that represented the first electronic nurse-to-nurse TOA implemented in Epic at HHS. So that's one of many examples truly of the exceptional care that they provide. But the nominations go on to speak about how their approach to caregiving, education, and community reintegration is exemplary. No one feels left behind, and patients and families know who to contact for emotional well-being and to address those coping mechanisms to provide that support system. So congratulations to B2 North, and their director, Danielle Petrocelli, will accept the award on behalf of the team and say a few words. So Danielle, I'll invite you to come off mute if you may.
Thank you, Danny. I am just thrilled to accept this award on behalf of the B2 North Stroke Rehab team and their fearless leader, Keisha Jack. This is just remarkable. It really is a testament to the exemplary care they provide, supporting our patients and families and also going above and beyond. I am new to the Regional Rehab Center and B2 North Stroke Rehab team. And from the moment I walked on the unit a few months ago, I was so impressed with the way they are so engaged with one another, their huddles. It really is something to see in action, and is truly remarkable. And all of this, and the last many months, they've been supporting Momentum Stroke Distinction. So preparing for the on-site survey, which is the week of May 26th. Tremendous amount of work they've undertaken, but really performing as a team collaboratively and providing best care, certainly for all our patients and families. So this is such a wonderful recognition of that team. So thank you, Jenny, and to the committee for recognizing this tremendous team.
This really is a tremendous team. Thanks so much, Danielle. Congratulations, B2 North. That was our very first Team Nursing Award. We'll move on to the second award now. So the second Nursing Team Excellence Award, this one goes to, congratulations, to the Emergency Department Nursing Team at the Juravinski Hospital. There were two outstanding nominations about this extraordinary team. They implemented quality audits in order to review and support the in-year objective of readmission rates, and routinely use CQI methodology to improve their documentation of pressure injuries and working through whether they're hospital acquired or if they're sustained within our sites. They are an evidence-informed team using SIRS criteria at triage to identify early signs of sepsis, and recently their work around ambulance offload times had garnered a significant recognition from the City of Hamilton to celebrate those process improvements. But this team really does focus on patient-centered care in an ER that is continuously working at 110%, working together under very trying circumstances and supporting each other in the hospital and outside. They speak to their greatly improved offload times with a flow nurse to decrease the amount of time a patient is waiting to see a doctor, really making for more satisfied patients and better patient care. They have recently brought in lab techs to help with blood draws and also with ECG. Working together, no matter how busy it is, this team sets goals and works hard to achieve them. They never stop learning, and they are constantly taking courses to improve themselves. And they also speak to a phenomenal manager who supports them and listens to their concerns. So congratulations to the emergency department at the Juravinski Hospital for the second Nursing Excellence Team Award. And Mark Copeland, the manager, will be accepting this award on behalf of his team at the Juravinski. I'll invite him and their director, Liz Ferris, to say a few words.
Thanks. Thanks, Jenny and everyone. Good afternoon. I'm so excited to recognize the Juravinski Emergency Department for winning one of the two Nursing Team Excellence Awards. What a fantastic and well-earned achievement. Now, anyone who knows this team knows that they don't just show up. They compete, they deliver, and they do it all while providing this compassionate, high-quality care to patients in their most vulnerable moments. Whether it's, as you mentioned, Janny, those pay for results, including the ambulance offload times, where the Juravinski Emergency Department consistently sits in the top 10 performers in the province. The treatment triage, where our nurse practitioners and PAs work with our nurses to improve timely access to care. They're not just meeting targets, this team is chasing them down with purpose and pride. The JHED has managed to improve times, enhance quality care, and still treat every patient like a human being, not just a metric. So that's no small feat and really a reflection of the integrity, teamwork, and heart that defines this department. So congratulations again. This recognition is so well deserved, and I have no doubt that they're already planning on how to win next year's award too. So I'll hand it over to Mark for some additional comments. Thanks.
Good afternoon, everyone. Thank you on behalf of our team. As a manager, I'm humbled to work with this group, and it's a privilege to be here day in and day out, see the work that they do. When they signed up to work at Emerge, they signed up to what would be a very unpredictable environment, but they stay true to themselves, true to each other, and couldn't be more proud of the work that they do. So thank you again on behalf of the team. And just so you know, we have a room full of our frontline staff in our conference room at the Merge at the JH, and we have cake.
It's wonderful to hear, Mark. Thank you so much. Hope that cake is shared with everybody else at the Juravinski, though.
There you go.
Congratulations to your team. We'll be sure to make sure that we visit both of these outstanding teams and present these awards in person too. So congratulations. We'll move on to the next one. I'm pleased to present the first individual award. This one is Equity, Diversity, and Inclusion Award. This award is presented to a nurse who actively incorporates EDI principles into their practice and encourages activities that foster equitable and sustainable change for equity-deserving populations. This nurse in particular shows passion in promoting and committing to EDI through teaching and learning, research and scholarship, through engagement, and also enhancing the working environment. And this means a strong commitment to patient and family-centered, as well as culturally sensitive care that's provided while recognizing strength and diversity. The winner of this award last year was Emily White from MCH. All of our previous award winners, as I mentioned, were asked to participate in reviewing and scoring the nominations for these respective awards. And for this one, we received 6 outstanding nominations in this new award category. So very pleased to announce that the winner of this award is Stacey Hamilton. So Stacey is an RPN within our NRT team. She supports all of our sites. And while Stacey was the winner for this award, I also wanted to share that she was also nominated twice for the Mentorship Award as well. So congratulations, Stacey. She's an active member of the Nursing Quality Council as well as the Health and Equity Collaborative. She self-funded the NRT Social Committee and leads these activities. I had the pleasure of actually bumping into her yesterday at the general site and said hello. So Stacey, you truly are in your nursing era. Her nominator had this to say about her. So meeting with Stacey's RPN clinical group, I observed her dedication to creating a diverse, equitable, and inclusive environment. Her group, Diverse in Ethnicity, flourished under her mentorship, with Stacey addressing racial bias directly. She empowered students to report any racial discrimination from patients or staff, fostering trust and also professional growth. She ensures all students, regardless of background, have equal opportunities to develop their skills. And even on days with fewer clinical opportunities, she generates learning chances for everyone. Her hands-on, vocal approach really enhances teamwork and respect among students. Students appreciate how she encourages self-reflection, addressing systemic barriers in healthcare. She creates a safe, supportive space where mistakes are viewed as learning opportunities. Her mentorship promotes mutual respect, cultural competence, and a commitment to advocating for equitable care and dismantling healthcare injustices. This is an amazing testimonial to the work Stacey is doing to recognize and address inequities in practice and care. So congratulations, Stacey. So I'll invite you to come off mute and turn on your camera if you may.
I'm going to turn my camera off, so you probably won't see me, but a car full of girls.
Congratulations, Stacey.
Thank you.
Oh, there
I really
you are.
appreciate the knowledge. I am. I'm just driving home from a baseball tournament. I want to thank whoever has nominated me for this category. It really means a lot. It takes a lot of hard work and dedication to try to bring forth knowledge and communication to those that I am teaching. But the committees that I have been on, even though people don't really see what we do, when I am on a floor, I can see the impact that it does make with all our nursing staff. And the comments that people make about the small little changes that we've implemented and made seem to make a big impact in their work environment. So I really want to thank you all for this award.
Congratulations, Stacey. Okay, I have the pleasure of now presenting the second individual nursing award. This one is the Inspirational Nurse Award. This one is presented to a nurse in a patient-facing role who is energetic and passionate about their practice. This nurse consistently demonstrates a strong desire to grow, to innovate and learn, and often advocates for positive changes, acting as a catalyst to motivate others. Inspirational nurses also often elevate and inspire their peers to seek out opportunities to be involved in initiatives. Last year's winner was Tanisha O'Brien from the JCC Clinics, and this year we received 37 nominations in this category. So congratulations. The winner for the Inspirational Nurse Award is Nicole Reed. So Nicole is a labor and delivery nurse out of our McMaster site. She's an ONA rep, a charge nurse, and also holds additional certificates in leadership. And her nominator had this to say about her. She started on our unit several years ago. She's bright and enthusiastic and very smart. She has incredible people skills, but most of all has manager written all over her. Her approach, her manner, her ability to cope with difficult conversations, her ability to self-direct, and her incredible leadership give her the edge over many. People simply adore her. She knows policies and procedures, and more importantly, she just does it so simply. She makes her job look easy, and that takes skill. Nurses like her are rare. You have to be good to be a nurse and survive the hectic schedule and work pace, and you have to be exceptional if you can balance that and mentor and lead your team to a successful ending each day. She inspires all the new nurses to their new roles. She volunteers for the tough cases and even the complicated ones. Her energy and enthusiasm is infectious, and she is such a pleasure to work with and be around. Her vision is to one day lead a unit or an area. Patients adore her for her knowledge and her approach, and as a labor and delivery nurse, your role changes so much over a shift. It could be the patient's best day in labor or their worst day delivering a baby with a poor outcome. She is able to handle all of this with professionalism and caring. Her ability to manage difficult and critical situations is point on. I admire her spirit and her energy, and most importantly, I applaud her love for her career. So congratulations. So unfortunately, she can't be here today, but her manager, Shasta Cividino, will say a few words about her instead. So Shasta, I'll invite you to come off mute if you can.
Great, thanks, Jenny. Thank you for giving me the honor to accept this award on behalf of Nichelle's graciousness. I have been honestly inspired by her every day that we worked, and I do have a few things that she wanted me to share with the group, so I'll read them to you now. So Nichelle has written that she's deeply honored to be nominated and selected to receive the Inspirational Nurse Award. Nursing to her is not just a profession, it's a privilege to support, comfort, and advocate for people during some of their most vulnerable moments. This recognition is not hers alone, but reflects the support of her colleagues, mentors, and the patients who inspire her every day, and she is incredibly grateful for this honor that's been bestowed. So just wanted to say thank you, and we very much appreciate the recognition for Nichelle.
Thank you so much. Thanks, Shasta. Congratulations, Nichelle. We're moving on to our next one as well too. So I'm pleased to present this year's Rising Star Award, the third Individual Nursing Excellence Award. This award is presented to a novice nurse who demonstrates credibility and maturity to their team. This nurse is also very eager to learn, and their enthusiasm is contagious. A rising star is someone who demonstrates critical thinking to really positively impact patient outcomes with a strong focus on increasing patient safety. This particular nurse demonstrates commitment to supporting the team through positive and meaningful connections and contributions, and nurtures her own passion for learning and inquiry. Ryan McNally from the JHED site was last year's award winner, and this year we had 22 nominations in this category. So congratulations. The winner of the Rising Star Award is Kyle Carrerio, RN in 3B1 Adolescent Medicine and Inpatient Eating Disorders Unit at the McMaster Children's Hospital. Kyle is an active participant in CQI huddles. He's vigilant with SOR reporting. He's an EPIC super user and is a member of Hamilton in Motion. He has maintained certifications in BLS, in CPI and nonviolent crisis intervention training, dialectical behavioral therapy, and has completed the charge nurse development program. His nominator had this to say about him. Kyle consistently demonstrates exceptional critical thinking and decision making in complex clinical situations and leading to positive patient outcomes. He frequently serves as the overnight charge nurse, showcasing sound judgment and leadership. For example, when managing a patient with suicidal ideation, he quickly identified risks and took proactive steps to ensure timely de-escalation and safety. Kyle is committed to patient-centered care, integrating cultural sensitivity and fostering strong relationships with patients and families, contributing to better care and outcomes. He prioritizes continuous learning, attending educational events, and applying new knowledge to clinical practice. Furthermore, he actively participates in CQI. He drives process improvements and patient safeties. Their collaborative spirit and dedication to teamwork enhance the work environment, making Kyle an invaluable asset to both the team and to the profession. So congratulations, Kyle.
Thank you. I'm honored and humbled to receive this Rising Star Award. This recognition means so much to me, not just as my own personal milestone, but also as a reflection of the incredible support and inspiration I have received from my team over on 3B1, as well as all the incredible patients and families I have had the privilege to care for. To those who have guided me, encouraged me, and believed in my potential, a huge thank you to you guys. This award fuels my dedication to keep learning, growing, and giving back. Once again, thank you for this award.
Congratulations, Kyle. I know your entire team is celebrating you today. I want to take a moment to acknowledge a posthumous nomination for an RPN who unexpectedly passed away last month on April the 7th. Doug Culp was an RPN for 15 years, and he worked in the same-day surgery unit at MCH. Doug received many compliments from patients and families during his career. He was known as a man of infinite kindness, humor, and love. Doug had a long career in construction, but returned to school as a mature student to pursue nursing, and he was described as a man of boundless empathy and compassion and a natural healer. He was fittingly nominated by his peers for the Patient Experience Award, and his nomination stated that Doug often went above and beyond to get to know patients and families. He always ensured that patients were as comfortable as possible, given the highly stressful situations they were in, and his goal was always to make each person laugh at least once during their visit. I know many were impacted by this loss, and our sincerest condolences go out to his colleagues, to his team, to his family, and to his friends. And we'll be sure to share Doug's meaningful contributions to nursing with his family and loved ones. And if you do have any stories to share with Doug's family, please email our HHS nursing email account with this information, and we would be happy to collate these stories in Doug's memory. For the fourth Individual Nursing Award, this is Patient Experience Award. This award is presented to a nurse who goes above and beyond to consider the holistic needs of patients and families by providing support, the timely communication, and inclusive practices to ensure they are included in all aspects of the care trajectory. And these nurses often exemplify organizational values in supporting and recognizing the needs and concerns of patients and families while recognizing unique personhood. And these nurses often reflect and debrief after challenging interactions, demonstrating empathy and strong situational awareness. These actions often allow for improvements in communication and also to prompt others to examine their own practices with patients and families. Our winner last year was Carol Plumer from PICU, and this year we received 28 nominations in this category. I want to extend my congratulations to Allison Lovell, an RN in our neonatal intensive care unit at McMaster Children's Hospital. So congratulations, Allison. Allison's on the Brain Health Committee. She also received a nomination for the Mentorship Award as well. Her nominator had this to say about her. What sets Allison apart is her commitment to inclusive practices that truly reflect the diversity and uniqueness of each individual. She never takes a one-size-fits-all approach to care and recognizes the importance of personal experiences, the backgrounds, and preferences in the healing process when interacting with patients and families. This personalized approach enables her to connect with patients and families on a deeper level and ensuring that they not only receive the best care possible, but they also feel respected and understood. And over the past year, Allison has faced many challenging scenarios in the NICU and has not only navigated them professionally, but has also taken the opportunity to reflect and bring back positive improvement opportunities to better serve our patients and their communities. Congratulations, Allison. I'd like to invite Allison to go off mute at this time if you'd like to say a few words.
Yes, thank you so much for those kind words. I can't think of an award that would be more personally meaningful to me than that one. And I'll just take a couple minutes to summarize what patient and family-centered care means to me in my unit. So for me, of course, in its simplest form, it's providing high quality patient care. But more than that, it's the little details such as warmth, cleanliness, developmentally supportive care, and maintaining a safe and organized patient environment for the littlest of patients. And deeply intertwined with that are the families, as was mentioned in that nomination. I found that as I've become more experienced in the NICU setting, I've been able to actually really broaden my perspective to prioritize the families at the forefront of care. For me, this means advocating for families behind the scenes, making sure they have access to the resources and the supports that they need. It means taking the time to get to know who these families are, what is important to them, what they might need, and how I can meet them where they are at. And it means empowering parents to be primary caregivers for their babies through educating, through creating opportunities for them to have hands-on interactions as often and as involved as they are able to be. And lastly, to me, it means including these soft skills and these conversations about the importance of family-centered care and ways to incorporate the family with every new nurse and student that I precept in the unit. I just want to extend a huge thank you to all of the exceptional nurses who have mentored and supported me along the way and who have helped me to become the nurse that I am today. So again, thank you so much. And congratulations to all the other winners and nominees, and happy Nursing Week to all the nurses out there.
Thanks so much, Allison. Congratulations. Those soft skills are oftentimes a lot harder. They can be the hard skills. We'll move on to the Mentorship Award now, the fifth Individual Nursing Award. And this award is presented to a nurse who acts as a positive mentor to others. This nurse values the diversity of perspectives, is knowledgeable and non-judgmental, and provides constructive feedback to their peers. They do this by encouraging and empowering confidence in learners to reach their fullest potential through coaching, and also going the extra mile to support and grow others. The deserving nurse embodies excellence in supporting learners and peers to achieve their professional goals and support professional and personal growth. Shelley Farrell from the PICU was our winner last year, and there are 39 nominations in this particular category. So extending a very sincere congratulations to Stephanie Smith. Stephanie is an RN from 4 West Cardiology Vascular Surgery at the Hamilton General Hospital. Her nominator had this to say about her. Stephanie actively participates in discussions related to nursing practices and healthcare policies. She provides input on initiatives that aim to enhance patient care and improve nursing workflows. She has contributed to the creation of educational programs for nurses. She ensures that both new hires and experienced staff receive the guidance they need to grow professionally. Stephanie is knowledgeable and non-judgmental. She is a subject matter expert and consistently shares her knowledge with colleagues. She has an ability to explain complex procedures and medical conditions in simple, relatable terms that have helped new nurses build their clinical competence. For example, she assisted a colleague struggling with managing critical care patients by offering personalized coaching as well as real-time feedback, and this led to a marked improvement in that nurse's confidence and skills. Moreover, she embodies a non-judgmental approach by creating a safe space for others to ask questions without fear of being criticized. Another recent example was when a nurse made an error in a clinical procedure. Rather than reprimanding them, she calmly walked them through the mistake, provided the constructive feedback, guided them through the correct process, and ensured that they learned from the experience without feeling embarrassed or discouraged. What a wonderful testament to her mentorship skills. Congratulations, Stephanie.
Hi, good afternoon. I'm deeply honored and humbled to accept this mentorship award. I want to first thank my colleagues and leadership team for nominating me for this award, for believing in me and giving me the opportunity for growth. I would also like to thank our organization and selection committee for recognizing the importance of mentorship and entrusting me with this award. I'm grateful to work alongside such dedicated and compassionate group of professionals. I believe the role of mentor is not to provide advice or offer direction, but to listen and empower others to find their own path. It's about being resourceful and offering a listening ear, and sometimes just being there when someone needs it most. I've learned that true mentorship isn't about having all the answers, but about fostering an environment where others empowered to ask questions and explore on their own. When I first started working at the General, I was fortunate enough to work alongside many seasoned nurses, some being the most memorable mentors for me in my nursing career thus far. I want to thank them for shaping me into the nurse I am today. Their examples have been a constant source of inspiration for me. Thank you again for this wonderful recognition. I look forward to continuing this journey of learning, growing, and supporting others within HHS.
Congratulations, Stephanie. Very well deserved. We'll move on to the Leadership and Quality Award. This is the 6th Individual Nursing Award, and this award is presented to a nurse in a leadership role who nurtures a culture of quality and strives to improve the processes, the safety, service delivery, as well as patient care. These nursing leaders often demonstrate organizational values to support the needs and concerns of their patients, families, and teams. They motivate others and provide guidance and clarity in times of uncertainty. These nurses role model professionalism and accountability, oftentimes inspiring others to be catalysts for positive change. Gidget Carlin, the manager for the HITS team, was the winner, last year's winner of this award. And there were 34 nominations in this category, and there were so many excellent nominations. I'm very pleased to announce that the winner of this award is Keisha Jack. Keisha is the clinical manager for B2 North Stroke Rehab, and she received 7 nominations from her team for this award. And while I won't read all of them aloud, they all consistently spoke of her collaborative leadership and the trust that they had in her. It is a profound honor, they say, to nominate Keisha Jack, the clinical manager, for the Leadership and Quality Award. Keisha exemplifies transformational leadership through her compassionate approach, strategic thinking, and unwavering dedication to clinical excellence. Her leadership not only uplifts staff, but also has a measurable, lasting impact on patient care and team well-being. She recognizes and cultivates leadership potential across all disciplines. She believes nursing is the backbone of healthcare and consistently promotes the growth of nurses and allied health professionals alike. Under her leadership, frontline staff are empowered to lead quality improvement initiatives, to create patient education materials, and tools and share evidence-based practices. Her approach to recognition is embedded in the unit culture, resulting in heightened morale, professional competence, and confidence and accountability. And she has so many outstanding nominations, truly. But what a testament to Keisha's commitment to developing future leaders within HHS. So, congratulations, Keisha, on all of these wonderful affirmations and recognition of your leadership. And Keisha, if you're available and you're willing to say a few words, we'll invite you to come off mute.
Yes, I'm here. Thank you. I'm humbled and deeply honored to be receiving this esteemed Nursing Leadership and Quality Award today. While this award has been presented to me, it is a true reflection of the incredible teamwork, the dedication, and unwavering commitment in providing the best care for all that I observe consistently the interprofessional team. Nursing leadership is about collaboration, and it's about motivating each other and fostering an environment where everyone feels empowered to provide the very best care to our patients and their families. I am profoundly grateful to the Nursing Awards Selection Committee and those who have nominated me. Your belief in my contributions to the nursing profession and as a leader means a lot to me. I want to extend heartfelt thanks to my incredible team, B2 North Stroke Rehabilitation. Thank you for your hard work, your resilience, and your shared commitment to excellence. You inspire me every day. I also want to acknowledge my colleagues. Your unwavering support, understanding, and patience is truly appreciated. You've celebrated the triumphs and offered comfort during challenging times that are inherent in our role. Thank you for always believing in me. Nursing, at its core, it's about service, it's about advocacy and continuous learning. It's about supporting others during their most vulnerable moments and offering not just our clinical expertise, but also kindness, empathy, and often just a listening ear. And as leaders, we do have a profound responsibility to champion these values, to nurture the next generation of nurses and other interprofessional team members that we do lead, and to continuously seek ways to improve patient outcomes and the healthcare system overall. I just want to close by saying that this award is not just a recognition of current and past achievement, but it also is a motivator to continue to strive for excellence, to advocate for our patients and our profession, and support and mentor those that we do lead and those that will lead after us. Thank you once again. I'm truly honored.
Congratulations, Keisha. We'll move on to the final Nursing Excellence Award for the individuals. This is the Nightingale Award. And this award is presented to a nurse who embodies the core behaviors and values of nursing, and this includes role modeling, inspiring others, creativity, as well as fostering accountability and decision-making, leadership, mentorship, and also, of course, supporting new learners. This nurse strongly focuses on patient outcomes and continuous improvement by applying nursing knowledge, skill, and judgment. They emphasize the support and sensitivity to patients and families through education, empowerment, and advocacy while utilizing critical thinking with evidence-informed practices. Alison DeHont, a clinical nurse specialist from St. Peter's, was last year's Nightingale Award winner, and this year there were 35 outstanding nominations in this category for this year. So sending a very big congratulations to the winner of the Nightingale Award, going to Haley Tucker. Haley is a registered nurse and works as the education clinician within clinical practice and education, and she supports the MCH emergency department. She's on many pediatric committees, such as the Pediatric Emergency Medicine Simulation and Outreach Committee, and also the CQI leadership team, the Vascular Access Committee, the Medication Safety Committee, Code Blue Committee, and so much more. Haley is a Trauma Nursing Core course instructor, a CTAS instructor, a member of the National Emergency Nurses Association, and has also presented at the International Meeting on Simulation in Healthcare. Her nominator had this to say about her. Truly, as the educator, she plays an integral role in supporting a dynamic, fast-paced, multidisciplinary team. Her impact goes far beyond her job title. From clinical expertise to educational leadership and mentorship, she not only meets the standards of the Nightingale Award, she surpasses them. Through her empathy, effective communication, and relentless dedication to high quality care, she leaves a lasting impression on everyone she works with. She's part of the heart of our department, the glue that keeps our team grounded, motivated, and is often smiling, even on the toughest days. She's a lifelong learner, bringing curiosity and passion to everything she does. In addition to her full-time role and extensive responsibilities, she's also pursuing her Master of Science in Nursing. This is a reflection of ongoing dedication to her personal and professional growth, and it's clear she has a drive for knowledge and a commitment in sharing it. And Haley doesn't just inspire change, she creates it. We can think of no one more deserving of this recognition. So congratulations, Haley.
Wow, thank you so very much. I'm so deeply honored and humbled to be nominated alone and to receive this award. And I really think it's a testament to the, incredible teams and leaders that I get to work alongside, including the fantastic team and my mentors in Peds Emerge, at McMaster Children's, as well as clinical practice and education. They've all been so instrumental in supporting my passion for quality improvement so we can provide the best care for our patients and families, even on their worst days, supporting my being an eternal student and fostering my growth as a leader. So I really am just tremendously grateful for having the opportunity to work in this role where patient and family-centered care gets to meet best practices alongside some of the best humans you'll ever meet. So thank you sincerely for this very meaningful acknowledgement. It means the world to me, and happy Nursing Week, and congratulations to all the award winners and nominees.
Wonderful. Thanks so much, Haley. Congratulations. And truly congratulations to all of our outstanding nurses, our nominations, those who are nominated, as well as our winners and our nursing award teams as well too. So as mentioned, these awards will be presented in person to the winners after Nursing Week. And as we're wrapping up today's award ceremony, really would like to take the opportunity to acknowledge the hard work and support of many, everyone who was involved in today's award ceremony and other events to celebrate this week. So in addition to the award selection committee, we also have our planning committee that includes Esther Coker, Erin Burrell, Natalie Plusini, Suki Carr, Trish Haycock. We have Melissa Cummings, Veronica McGee, Ellie Stutson, Jeff Andrews, and of course my co-lead Jennifer Lounsbury, and to all of you, truly. Thank you for your contributions, your insights and perspectives to make this week such an exciting week to really celebrate such an amazing profession. And of course, my utmost appreciation to you, Dorothy. Many of you have interacted with Dorothy Petty with all things nursing. Dorothy, thank you for your hard work in ensuring this is a success and also to help in helping to acknowledge the tremendous role that nurses play. She has truly gone above and beyond in so many different aspects, and we could not have done this without her superior skills. To all of you here today, whether you're a nurse or a supporter of nurses or a leader of nurses or simply a nurse at heart, your presence is very much appreciated for supporting and celebrating your nursing colleagues this week. So I hope that you'll continue to take part in the festivities and, of course, express your appreciation to all nurses throughout the week, as well as share the amazing contributions that nurses have made at HHS. You can do this either through those e-cards, the star cards, simple actions, written word. Congratulations to all of our nominees and our award recipients today. So at this time, I'd like to invite leaders to put up their hands if they'd like to share any few words as we wind down the award ceremony. Leslie, I see your hand up. Go ahead.
I just wanted to thank you, Janie, obviously thanking everyone that you've identified and even more obviously behind the scenes, but for everyone's contributions. But thank you, Janie, for your leadership and dedicated commitment to today's awards, but the entire Nursing Week. It's a lot of hard work and facilitation and lots of steps, as you said. So thanks very much. It is appreciated and valued.
Thank you so much, Leslie. It's my honor and my privilege, of course. Okay. Seeing as there's no other hands, truly thank you all for attending today. Congratulations to you all. Congratulations again to our outstanding award recipients. So we'll close with 3 minutes left to spare. Happy Nursing Week, everyone.
Thank you.